Hi, everyone.
Hi.
Welcome. I'm so excited to be here. Dr. Asante, welcome. I'm going to really kick us off here, and we're going to get into the meat of it. And we will have time for folks to ask questions. So feel free to put them in as they come to you, and we will dive in. So welcome to our webinar today, Your Fertility Roadmap from Questions to Confident First Steps. Here's the plan. We're going to start out with insights from Dr. Asante. Then I'll guide a conversation to kind of address common questions and take us through a flow. And then, of course, as I mentioned, we'll open up for a live Q&A at the end, so you can ask your own questions. So to introduce myself, I'm Lauren Burson. I'm the founder and CEO of Conceive. We're a digital health platform aimed at changing fertility and pregnancy outcomes. And really what we do is 24/7 texting with nurses and coaches. We act as an extension of the care team of our clinic partners to reinforce the why behind a particular treatment and provide answers to clinical questions throughout the day within minutes. And we offer peer coaching from folks who've been in your shoes. So they've been through every version of a fertility and pregnancy journey you can imagine. My focus on this problem and intention behind the company is deeply personal. I welcomed my daughter into the world after 3 challenging years filled with heartbreak, misinformation, and failed treatment. And Conceive is really the solution I wish that I had. And I'm joined today by Dr. Albert Asante, MD, MPH. He is a double board certified fertility specialist in obstetrics and gynecology and reproductive endocrinology and infertility. His clinical practice covers a wide range of general infertility and reproductive endocrine conditions with a particular focus on PCOS, reproductive age women, recurrent pregnancy loss, fertility treatment for reproductive age women, and IVF. I actually appreciate how this is all how this is categorized here. Dr. Asante earned his MD from the University of Ghana and MPH from Harvard, no big deal, and completed his OBGYN residency at Emory, followed by a fellowship in reproductive endocrinology at Mayo Clinic. So a real underachiever we are here with today. This is incredible. Dr. Asante is skilled in performing advanced reproductive techniques and has clinical interests in premature menopause, which maybe I should bother you about, which scares me, primary amenorrhea, elective and medically indicated fertility preservation, and advanced hysteroscopic surgery, which I've unfortunately had some of. So welcome, Dr. Asante.
Thank you, Lauren. Thank you so much. I'm looking forward to this.
I'm so excited. We have a fantastic agenda with really a focus on sort of demystifying treatment, discussing actionable steps that you can take. And so we'll start by breaking down like what you need to know about fertility treatment, walking through the physical process of starting treatment, kind of talking through a 101 of your options, whether you're just getting started, considering IUI, IVF, or other treatments. We'll basically give you a good synopsis of the basics to help you understand the menu, as I like to call it. So, Dr. Sunday, let's dive in. Let's start with an overview of what happens when someone decides to pursue fertility treatment. Like, what are the key steps, timelines, and what should they expect?
Absolutely. Thank you, Lauren. And hi, everyone. Thank you so much for joining us for today's webinar. Just like Lauren said, this is fully packed with very useful, very actionable information. So let's get right. Let's get started. So to answer your question, we usually will start off with the new patient consult for patients that are struggling with infertility. We call it the NPC. And this is a consultation that can be done online or in person. So
Yep.
these days we can do telehealth or in person, and it typically will last anywhere from 30 to 45 minutes. So during this visit, we will get a detailed medical, surgical, or reproductive history for the couple. And then
Mm.
we also will take the opportunity to give the couple an overview of what infertility is, the causes of infertility, the workup, and then the management options. And then at the end of the visit, we will get the necessary testing ordered, and then we'll schedule a follow-up appointment.
That's fantastic. I love that you specifically said the couple because I
Yes,
think, one of the things I see a lot is folks really think of fertility as a women's health issue. And in reality, it affects men and women equally, right? And,
absolutely.
is a semen analysis part of that initial workup that you guys do?
It is 100%. And
Amazing.
and I hope we'll get a chance to talk about some of the myths and misconceptions about infertility. It's one of the areas we are trying to address for the general public, that infertility is not a woman's issue. It's usually a team sport, is how I like to put it. So it's the
True.
male, the male and female.
I love it. It takes
So
two to tango.
it does 100%. And whilst we're at it, we also have to mention that some of our patients may be single parents. So it could be just the woman wanting to get pregnant. It
Absolutely.
could be a male wanting to get pregnant. And in those cases, they will definitely need to use a donor sperm or donor egg. So,
Yes.
but then we will be talking more about couple, just to make it simple.
Yes.
So as part of the workup, we will do the the testing that we do is very important. At the end of the gathering the history from the couple, we are usually able to have some idea about what is likely the cause of the infertility. But without the testing, we cannot really say. So we need the
Right.
testing to be able to pinpoint exactly what the cause of the infertility is for the couple. And
Hmm.
we I usually like to break it down into three main categories as far as the testing
Mm.
that we will do for the couple. So number one is the sperm actually. So that's usually my first testing that I will order. And we do what we call a semen analysis, where we are going to look at the volume of the semen. We're going to look at the concentration of sperm, the motility, morphology, and if there's any evidence of inflammation in the semen sample. And so that is a very important part of the workout for the couple. If I may go on and finish with the testing in general. So for the female couple, for the female partner, we will do imaging testing or imaging studies. One of
Yeah.
the important imaging studies is HSG or hysterosalpingogram, where
Hmm.
we evaluate, and you probably have experienced it before, but we want to find out if the fallopian tubes are open. So you need the fallopian tubes to be open in order for the egg being released from the ovary to travel and meet with the sperm for fertilization to take place. So we check to see if one or both tubes are open. And then also as part of the imaging studies, we will do a pelvic ultrasound or vaginal
Hmm.
ultrasound where we take a look at the uterus to make sure you don't have any fibroids or any uterine anomalies. And then we also look at the ovaries and make sure you don't have any cysts on them. And then the third category of testing is blood test. So we do blood tests for, again, both partners. So for the female, the blood test will be to check hormones like progesterone, which will tell us whether the female is ovulating or releasing eggs every month or not. And then another set of hormone testing will give us an idea about the quantity of eggs they have in the ovaries. And so these hormones include AMH, FSH, LH, and estradiol. And then for both the male and female partners, we will do what we call preconception screening. So these are testing that is very important for us to make sure that your health is optimized before you get pregnant. So we check to make sure that you don't have any infectious diseases like HIV, hepatitis, syphilis. We also do genetic screening where we screen for inheritable genetic conditions, and then also make sure your kidney function is good, your blood count is good. We know your blood type, making sure you don't have RH sensitivity problems. So there's a bunch of testing that we do for the couple before we can talk about treatment plan.
First of all, thank you for being just so thorough. And so you really have such a good way of breaking it down in like a digestible bite-sized way. We talk about that. Everything you just mentioned, we call the conceive basics, which is what we, when members come to us directly to us, not through a clinic partner, we're often guiding them when they're just getting started as to like, what do I do? Like, what are the things I should, sort of check off the list? One question I had for you, and I love how much you talk about the semen analysis being critical. I see we have some men in the webinar today, and not all men know that you cannot have sperm in your semen, and it is like easy, cheap, and pleasurable to get a semen analysis. So I say do it immediately. When in reality, sometimes it's sort of left to the last minute. But you mentioned sort of identifying a cause for infertility. Dr. Sante, do you also see patients that are just kind of getting started and they're like, I don't know what to do. I didn't learn anything in high school sex ed.
Yes. So, and here, are you talking about patients that have not even tried to get pregnant, or
Yeah, yeah,
yeah. So yes, these days, and I actually love to see such couples. They just got married or just got together, and they're like,
yeah,
we have not even been trying to get pregnant, but we want to educate ourselves and know what to do and what to look out for. So yes, we do see such couples or patients every now and then. And for such couples, we usually will go over the factors that can affect their chances of being able to get pregnant. So we will talk about what they need, what a couple would need to get pregnant. So you need a good egg to be released at the right time. You need your tubes to be open. You need a uterus to
mhm,
have a good cavity. And then you also need sperm, adequate number of good quality sperm to be released at the right time. So any factors that can affect any of these issues can lead to infertility. And
yeah,
then for those couples, usually we'll give them an idea about using things like ovulation predictor kits to know when they are ovulating.
yeah,
That tends to be one of the big problems with most couples, that they don't know when they are ovulating and how
yes.
often to be sexually active. So we go over all of those factors with them, and then they can go ahead and try for about 3, 6 months. And if no pregnancy after that time, then we can do fertility testing for such a couple.
That makes so much sense.
Yeah.
And so you mentioned these kind of four buckets of tests and sort of evaluations. How long does that process take from kind of your initial consult to starting treatment?
It varies. It's anywhere from about 2 weeks to about 6, 8 weeks, and this is why it varies so widely. For
Yeah,
patients that do not have any menses, that have or irregular menstrual cycles, we are usually able to do the testing the same day we see them. So we can do their blood test and do the ultrasound, and then we can schedule them to have the HSG done within about a week, and then have a follow-up appointment within about another week or two. So those patients are usually able to get the testing done quickly and then get started with the treatment as soon as possible. For patients that have regular menstrual cycles, depending on where we are seeing them in the cycle, we may have to wait for a next period and then schedule the testing to be done at the right time, usually within the first 1 week of the cycle, and then have a follow-up appointment about 2 weeks after that. So in general, depending on the kind of menstrual cycles you have and when we are seeing you, it may be as short as 2, 3 weeks to have the follow-up appointment and start treatment, and sometimes as long as maybe 6 weeks. And then also some patients are, of course, more responsive to instructions from our team than others. So
yeah.
after the consult, we will have our patient care coordinator reach out to them, schedule the appointment.
Mhm.
Some of them may follow up right away. Others too may talk about having to deal with life issues. So then they may miss the next
Yeah.
appointment and then have to wait till the next cycle. So yeah, so those are some of the reasons for the delay. Otherwise, for most patients, we're able to get them in as quickly as possible.
Yeah, it's so interesting. It's one of the
Yeah.
things that, I love about your model. I love that you have the coordinators. And then what's exciting is we're also working together and we have our nurses and coaches who are available to your patients to really help them give another set of like another view of why something is indicated, right? Of like
Yes.
why this would be a good idea to do now and
Yeah.
thinking through some of those things. Sometimes it takes just like another conversation to sort of
Yeah.
digest all of the things you have to do and really get that why. Um, I love one of the things I love because we got to spend some time at the clinics and with your team is also the very holistic approach that you take. And
Yes.
sometimes people hear holistic and they think it's like woo woo, but like, you're really talking about like lifestyle factors. What are
Yes.
some of the things that you consider and talk to your patients about when it comes to lifestyle, nutrition, all that good stuff?
Thank you, Lauren. When I get started with lifestyle factors, you may have to stop me at some point. Usually,
I
I
love it.
just
How much time do we have? Okay, great.
I
Buckle
can
up,
just
everyone.
I can just keep going for real. And this is because I have had personal experience with this. So just a little
Mm,
bit about me throughout medical school, residency, I used to work out like crazy. Everyone that knew me knew that I loved going to the gym, but then I was not taking care of other factors, especially nutrition,
mm,
which I will be talking about soon. So I used to weigh about 230, 240 pounds, and My wife will say, "You are a bit chunky." I'll say, "No, it's all muscle." But it wasn't. It wasn't. So 2020, around COVID time, that was when I really decided to look into lifestyle factors that will help optimize my health. And I came across the importance of nutrition and started implementing some of the information I was gathering. And within 6 to 8 weeks, I had gone down from 230 pounds to 185, and I've
Oh,
stayed that way up
wow.
to this point. So I can testify to how effective these things can be. Um,
Wow.
so so for anyone that is seeing me for fertility care, I will usually tell them that your lifestyle is pretty much like the foundation of a house. If you get it right, almost everything else has a very good chance of going well for you.
Yeah.
So you really need to take care of lifestyle factors. So we usually will start off with nutrition. And with nutrition, what I advise patients to do, which is what I have been doing, is to try and make sure that your meals contain a lot of lean protein, a lot of healthy
Hmm.
fats,
Hmm.
complex carbohydrates, non-starchy green vegetables, and then most importantly, to avoid foods that have high glycemic index. So I usually ask them
Yes.
to Google and know the foods that have high glycemic index and stay away from them.
Yeah.
The thing with foods that have high glycemic index, anytime you put any of them in your body, you're going to have a high insulin response. Insulin levels go up, and insulin is a
Hmm.
pro-inflammatory agent that will tell your body to keep fat in storage. So
Yeah.
if you're eating all those foods, you could be exercising, doing all the other important things, but still not losing weight because your body is just not burning the fat. So very important to make sure you are staying away from foods with high glycemic index. And then if you can, to also eat twice a day. I think for me that was the real important thing that changed things for me. So making sure that I skip breakfast and then your first meal around 11 or 12.
Ah,
Um, and when you do that, you give your body time to make use of all the food that you've accumulated in your body. It's also
yeah.
very difficult to have too much calories in your body when you are eating twice a day. And if you're going to eat twice a day, you make sure that those two meals are really healthy food. So
Hmm.
it's a win-win when you're able to do this. And then in addition to nutrition, you want to also be exercising. So you want
Critical.
regular, yeah, very critical, regular moderate exercises should include strength training and cardio training. And you want to do
Hmm.
that. I typically do that every morning these days. You wake up early, do it for about 30 minutes. But if you cannot and want to do about 3 to 5 days a week, you should see some benefit that way. So very important to exercise. And in addition to exercising, also make sure that you don't live a sedentary lifestyle, that you have an active lifestyle. So if you spend even 1 hour in the gym, but then the rest of the 23 hours you are just either in the couch or on your bed or sitting at the desk, you
Uh-oh.
have a hard time being able to
Think
burn
you're
the
talking about
calories.
me.
Ah, okay.
I
I
work out
didn't,
all the
I
time,
didn't,
but then I sit here.
exactly, exactly. So I make it a point after every patient consult to just walk around the building, and
Yeah.
patients
Yeah.
and the staff here will see me doing that. It's very, you have to remind yourself to do that, and then also
It's true.
use the stairs instead of the elevators. And
Hmm.
when you go to the mall or any area where you're driving, park as far away from the building as possible. My family is always fighting with me over this. How the heck why
That's
you
so
parking
funny.
so far away? Just so that you can get your steps in. So
I
do
love
things that
that.
will help you to be active throughout the day. Very important. And then and I told you, you may have to stop me, but let me touch
No,
on
no,
the
no. I
two
love
other
this, and I bet
things.
everyone else loves it too. It's
Okay.
great.
So two other things, weight management. So
Yeah.
in general, if you're able to take care of nutrition and exercise, it will help with the weight management because you want your BMI to be between 20 and 25. If for some reason you think you're doing everything you can, but your BMI is still too high or too low, less than 18 is not really good, then you may want to seek a dietitian or nutritionist and then make
Hmm.
sure, or just go to a weight loss clinic, especially if your BMI is over 40, to help
Yeah.
them get the BMI within the range. There have been tons of studies that have shown that high BMI is associated with infertility and then also associated with increased risk in pregnancy.
Hmm.
And then also stress management, very, very important. And it has to do, there's so many factors that can cause stress, but a lot has to do with the information you are consuming, in my opinion, and then the thoughts that you allow in your mind.
Oh,
So
yes.
just like you want to watch what you are putting in your body by way of food, nutrition, you also want to watch what you are putting in your mind and what you are dwelling on in your mind. The thoughts that you
Mhm.
have, those can help control stress. But if those are not helping, definitely seek professional assistance, counseling, therapy,
Mhm.
meditation, yoga, and several other stress relieving strategies that one can use. And then real quick, sleep is also very important. You want to make sure that you are getting deep restful sleep, at least 7 to 9 hours every night. That's how you help to reset the hormone balance in your body, and it resets your mind, and definitely helps improve chances of you having a successful pregnancy.
I love the well-rounded way you talk about this because what I think is so key is like, there's no silver bullet here, right? There's no like one thing that's going to get you pregnant immediately because believe me, I would have done it. But the reality is like a healthy mind and body allows for better things to happen, right? So it's not
Absolutely.
about, if you're stressed, you're not going to get pregnant, right? But
Yeah.
it's more about just taking care of yourself and sort of
Yeah.
taking those steps to make sure you feel good and that you're taking care of your body at the end of the
Yeah.
day, right?
Yeah.
And whether that means more working out, more walking, thinking, being thoughtful about food,
Yeah.
seeing, a dietitian, and taking those steps, I think it's so key. One of the things that I worried a lot about when I was going through my journey initially was I exercising too much,
Mm.
right? Like,
Mm.
or what? Talk to me about that. Is there a too much of any of this stuff?
Yeah, yeah, there can be too much of every stuff in this world for sure.
Right? Yeah, like
and
anything.
and so yeah, you want, especially when you're going through fertility evaluation and treatment, you want it to be moderate exercises. You
Yeah,
you want to run or use a stairmaster, or the or any form of cardio
cardio.
machines, yeah, that they have there, but don't overdo it. You definitely can overdo it. Maybe
Yeah.
45 minutes a day should be okay. Especially if you've not been the type of person that has been doing that before, right? If you are just getting into it, it's not. I always say that consistency beats intensity every time. You want to do something that you can do consistently, rather than do it one time in a week and then crash and think that
Yeah.
no, this thing doesn't work. So yes, you want to be really mindful of how you're doing this. The same thing with nutrition. You don't want to do things, starve yourself. I tell people,
No.
no, I don't starve myself. I feast. I do two
Yeah.
good meals and they are feast. That
Yeah.
if you come to see me eating, you're like, oh my God, they are really they're healthy, and it's a lot,
Yes.
and I'm not hungry, right? So when I'm so that I don't feel like snacking throughout the day. So don't do things that will eventually work against you. And then one additional thing I forgot to mention is substance use. So smoking,
Mm,
recreational drug use, especially marijuana, alcohol, all those things have been found to affect chances of getting pregnant and having successful
mhm.
pregnancy. Caffeine intake is okay if you're doing 1 to 2 cups a day, but more than two can negatively impact your chances. Yeah.
Yeah. Yeah. All of that is so key. The one thing
Mm.
you didn't mention are supplements. Not that we want
Supplements,
to,
absolutely. Yeah, yeah, yeah,
what's your
yeah. When it
perspective
comes,
here?
yeah,
Yeah.
yeah, yeah. I'm glad you brought that up. So definitely important. It's because it's very hard to be able to get those micronutrients from the foods that we eat these days. So you want to be able to take the supplement so you can get your antioxidants. So things like CoQ10, Ovasitol, very important. You also want to take agents that have anti-inflammatory properties. If you're a patient trying to get pregnant, curcumin, or turmeric is good for that. And then
Hmm.
prenatal vitamins also very absolutely important because it contains the folic acid, which
Folic acid.
helps protect the baby's spinal cord when you get pregnant. Yeah, so supplements are very important.
Critical. And
Yeah.
I think, one of the things that we really focus on with conceived members is, trying to play into the mindset of the member. There are some people who want to take 30 supplements, and so we can go through the list and tell them what might be harmful. And then there are folks that just want the basics, right? So I think
Mhm.
that's another piece of like finding the balance that works for you and not kind of overdoing it or overwhelming the system.
Yeah.
Talk to me a little bit about GLP-1s. Can you be taking GLP-1s when you're pursuing fertility treatment?
So the current recommendation is for patients who are trying to get pregnant, you need to be off GLP-1 at least 4 weeks before you get pregnant.
4 weeks. Okay.
Yes, yeah.
Okay.
So, and this is
Great.
just because we don't have too much data. We don't know the
We don't know. Yeah.
effect it's going to have on the newborn or the embryo in the
Yeah.
future. So they're just being cautious. Yeah,
Cautious.
yeah,
Yeah.
yeah. So if you definitely need to be on GLP-1, excuse me, you want to avoid getting pregnant until you've gotten to
Yeah.
the weight goal that you have, and then you go off it and try and get pregnant.
Yeah.
Yeah.
Okay, well, let's change gears a little bit. So as I mentioned, I also know firsthand how daunting it can be to try and build a family. It was very hard for me. It took over my life for probably 7 years. And a big part of moving forward with confidence is sort of addressing some of the fears. And we talk a lot about this and sort of we also have a holistic approach, which is and every great clinician like yourself knows that this is not just the medications and the appointments, it's also the emotional pieces, right? Like, let's talk maybe some strategies to help patients better prepare for conversations with their doctors, to reduce the anxiety around it. Any thoughts there?
Absolutely. So just like you mentioned, this can be a very important part of a patient's life where you are ready to have a baby and now having difficulty doing so. So
Yeah.
the decision to come to see a fertility doctor is not something you take lightly. It's a very important decision. And I think once you made the appointment to see a fertility doctor, there are certain things you can do to prepare and make sure that you are going to get the most out of that consultation. And I actually, from this morning's visit, I decided to start off with this point if this question comes up, and that is the fact that because of telehealth, some patients will schedule telehealth, and then whilst the meeting begins and they are driving, they're on the highway or they are at McDonald's or they are with a friend, that is really not good. It tells us
Yeah.
that you are not really interested in what we are going to tell you. So
Hmm.
I think patients, first of all, block out that time that you schedule for the appointment and know that this is really important. This is going to affect how you're going to feel for the next several months, if not several years. So you definitely
Yeah.
want to take this seriously. And then before the appointment, have a summary of your medical history. Know your medical history, what medical problems you have, what medications are you on, what's your reproductive cycle. Like we always will ask about your last menstrual period, so just note that or write that down. If you've had treatment in another clinic before coming to see us, make sure that you've requested for your records to be sent to us, and then actually call a few days before the appointment to confirm that we've received them. It will help us to review them before we meet you, so we are not trying to get
Hmm.
all these details whilst we are with you, because then that's going to take away time that we can use explaining things to you in trying to get all that information that we could have reviewed before the meeting. And then you also want to do a little bit of homework. I mean, personally, if I'm going to see any doctor, I'll get as much information about them as possible. Make sure there's someone you really
Yeah.
are going to believe what they're going to tell you. So do a little homework about the team, the clinic, the doctor you're going to see, and then also read up on your condition if it's infertility. And here, don't use just any random
Yeah.
blog
Don't Google
post.
it.
Don't Google.
Don't just
Just
Google it.
you want to use credible sources. So you can
Yes.
go to CRM. We have a tab under resources where we have information about infertility and other conditions that we see patients here for. So read from such sources. You can also go to ASRM, American Society for
Yeah.
Reproductive Medicine. They have reproductivefacts.org where you can get as much
Hmm.
information as possible. So use credible sources to get information about your condition, the management options, so that when the doctor is explaining it to you, you understand much better if you've read a bit about them. And then
I
write down
think
your questions. Yeah, sorry, go on.
No,
Mhm.
no, no, go ahead.
Yeah. So
Continue.
yeah,
Yeah.
and then write down your questions, and then
Yes.
because during the meeting you may forget, you may have thought about something, but then we start talking and then you
Yes.
forget. And then after the
You
meeting you
forget.
are like, oh, should I have asked? So just write down any question, especially during your as you're doing your research. And then when you come in, be honest and open with us. We are not here to judge. So any information you should share with us, and don't hold anything back. Because the more information you can give us, the better the chances that we can identify what we think is going on wrong, and then help you identify, treat it or manage it. And then you can also bring your partner, and if you have a partner, it's
Mhm.
advisable to bring the partner. If you don't, you can bring a friend just for support. And
Mhm.
again, if you have anything in your history that you wouldn't want anyone to hear, then probably don't bring a friend. But otherwise, because we
Of
will ask
course.
you all the important questions, whether your friend is with you or not. Yeah. So those are some of the things that you can do just to make sure that you become an active participant in your own health journey. You want to be really prepared for this consultation.
It's so, so helpful. And
Yeah.
I think, we talk a lot about kind of white coat syndrome, which is this notion that once you get into the doctor, you get
Yeah.
nervous, right?
Yeah.
And like,
Yeah.
I think it's so critical how you approach this and how you think about, okay, write down your questions and make
Yeah.
sure you ask them. That's
Yes.
something we also see a lot, men and women
Yeah.
alike, they may have written down their 15 questions and they ask two because they're
Yeah.
like, oh, they were busy. This is your time and you
Yeah.
want to be an active participant in your care. And
Yeah.
it's so, so critical. So I love how open and thoughtful you are about that approach.
Yeah.
And I think it's so interesting too, that sort of second order effect of telemedicine, allowing for people to be anywhere. But
Yeah.
unfortunately, that means they are not present and really
Yeah.
active,
Yeah.
which you really
Yeah.
want to be.
You
Yeah.
want to be like
Yeah.
100% here. Yeah.
Yeah.
Yeah. Yeah.
Um, we have, well, folks, if you have joined us and you have questions, we have a few in here. We will get to them shortly, so feel free to pop them into the chat. But let's talk a little bit about common misconceptions about fertility treatments.
Yeah. Again, here you may have to stop me at some point.
Buckle up, everyone. I
There's
love
quite a
this. I
few,
love
and
this. There are
and
so
every now and
many.
then, I'll be, with friends, and then someone would drop one of them, and then I'm like, should I address this now, or should I just be a
Keep
parent, a
letting,
friend, and
right,
just let
right.
it ride? But yeah, there are
The
quite a
same
few
way.
out there. Quite a few out there. One of them is, and probably the number one, and we touched a bit on this earlier on, is that only women undergo fertility treatments. So it's not uncommon at all to get just a woman show up and say, hey, we've been trying to get pregnant and I strongly believe it's me, so I just want to be checked out. I think my husband is fine. And then we say nope. It's like I said,
Nope.
it's a team sport. It takes two to tango. And
Mm-hmm.
then we share the statistics with them that it's actually one third of all causes of infertility are due to male factors. Another one third is due to the female factors. And then the last one third is
We don't
usually a
know. Yeah.
combination, or we don't know, right?
Yeah.
Yeah. So,
Yeah.
it's definitely not just the woman's issue for sure. And then the second one is it's not so much a misconception as in just probably a bit of ignorance, just not knowing. And I think we probably should be teaching
Mm.
this at the elementary
Yes.
or high school level,
High school sex ed.
the impact that age has on fertility for both men and women. So again, it's not uncommon to have a 40-something-year-old woman come in and just think that they've been having regular menstrual cycles, so have a hard time understanding why they could have issues getting pregnant. And then we have to share
Mhm.
with them what we call ovarian aging, which has to do with the fact that a woman is born with a fixed number of eggs, and these numbers go down with age. And typically,
Mhm.
by the time you are in your mid 30s, the quantity of eggs you have, it gets below a certain threshold, and it makes it difficult for you to get pregnant. And not only is the numbers going down, but also the proportion of the eggs remaining that are genetically normal also goes down significantly. So you
Yes.
may be releasing an egg every month, but most of the time that egg is genetically abnormal. So it doesn't get fertilized, or if it gets fertilized, you may have a miscarriage because of the
Mhm.
abnormal embryo. So age plays a huge role, not only in women, but also in guys. But then with guys, it typically kicks in their mid 40s to early 50s. But definitely for women, we tend to see age playing a huge role. The biological clock really ticks, so you want to pay attention to it. And
Mhm.
then number three will probably be the fact that fertility treatment is seen as a magic wand, and some patients will
Mhm.
have a hard time believing that they've done IVF but cannot get pregnant. And so it's important to know that especially with IVF, what we're doing is we're collecting eggs, collecting sperm, put them together, create embryos. We can actually even test the embryos to make sure they are genetically normal. But that is, there are so many other things in the embryos that we cannot test for. So there are other things that the embryo
Correct.
will need in order to grow that we just don't have the technology to test for. So you can put a genetically normal embryo in the uterus, and usually the chances of pregnancy is just about 60% plus or minus. So it is not uncommon to do fertility treatment and not get pregnant from one or two cycles. And it's important for patients to know this so they don't really get too stressed by the fact that it didn't work the first time. Most times you just have to keep going, and at some point it will
Mhm.
work for you. And then probably the other interesting one is where they come in and say, "Oh, my friend was trying to get pregnant. They did IUI and got pregnant. So can you do IUI for me?" And that has seen,
Yeah.
something work for my friend, so it should work for me too. But unfortunately, it doesn't work like that because just like we said, there are so many causes of infertility, and what is causing infertility in your friend's case might not be the case in yours. So we usually have to do the testing and then figure out what's going on with you, and then give you the appropriate care. Yeah.
I love that point because
Yeah.
that's one of the insights that led me to start Conceive. There
Yeah.
were many, but one of
Yeah.
the issues I had was like, first of all, when I was going through my infertility, I felt totally alone until I started speaking up. And then, of course, I heard from almost everyone around me. Everyone had a story, folks I
Yeah.
hadn't spoken to in 20 years, friends, strangers. But secondly, what I realized was you're kind of forced to form these underground networks of those who are suffering in silence, when in reality it's touching a lot of people. And you find these folks that I were sort of these informal coaches or mentors that had been through it and had come out on the other side. And they would tell you things about what worked for them.
Mm,
And it was great to hear that there was success, but what works for someone else doesn't work for me, right?
correct.
I'm
Correct.
42 in New York. If I go on a Facebook group or a Reddit forum or talk to a friend or a stranger and they're 22 in another state, like it's
Yeah.
completely different, right?
Yeah.
And so,
Yeah.
like, a lot of what we think about at Conceive is sort of how do you enable personalization at scale and
Yeah.
ensuring that people have the right access to the right information at their
Yeah.
fingertips versus that thing that you guys hear all day and we do too. It's like, well, why is this my protocol? Like my best friend's doing this, and it's like, well,
Yeah.
your best
Yeah.
friend is totally different. But you
Yeah.
also touched on, a couple other things I wanted to point out. Like, one of the other sort of misconceptions is that you can, well, and it's not to say you can't, but that we can measure egg quality and that we can improve it. In fact, there are predatory companies that say, like, take these supplements and we'll improve your egg quality. And it's like the reality is, unfortunately, we actually
Yeah.
can't really measure egg quality.
Correct.
There are some biomarkers like
Yeah.
elastic membranes and
Yeah.
vacuoles. I know my eggs seem to have those when I did IVF, unfortunately. So it's likely I have poor egg quality, but you can't really measure it. But we can measure is your sort of inventory, right? As you mentioned, your anti-Müllerian hormone indicates how many eggs you have left.
Yeah.
But the reality is we don't know what the quality is. And so that's why
Correct.
you may hear a story of someone conceiving naturally at 45 and then someone else who's having trouble in their 30s.
Yeah.
It sort of varies by person.
Yeah.
And it's an unfortunate piece, but I think it's also good to know because then you understand that AMH, low AMH doesn't mean you can't get pregnant, because
Correct.
we don't know what the quality of the reserve is. And that you also can't take a magic pill to improve your egg quality. And then, secondly, that waterfall you talked about with IVF. So when folks do IVF, it isn't a silver bullet. It gives you a much better shot than sort
Yeah.
of natural conception, especially when you've had trouble. But the reality is there's this whole waterfall that you go through, right? Where you get a set number of eggs that you are able to retrieve. Then you have to see how many are mature. Then you have to see how many fertilize. Then you have to see how many actually make it to blastocyst. And if you're doing testing, which is also unfortunately not a sure thing, but can, what we see at that point in time to see if they're genetically normal. I know I have a very bad waterfall, I'm below average, right? So whereas sort of the average number of embryos from 22 eggs could be whatever it is, I actually don't know what it is offhand, I would get one, which I
Yeah.
was very lucky to get one.
Yeah.
So it is another thing. And I think it's not to be doom and gloom or
Yeah.
sort of doom. It's
Yeah.
really just so that you know that actually on average, people need to do it a couple of times, like two
Yeah.
to three times to have success. So
Yeah.
just having that knowledge, I think, can be empowering. Whereas if you go in thinking it's going to work and then it doesn't, it can be pretty earth shattering for you.
Yeah.
And I should have known better, and I actually didn't. And so,
Well, that's why
um,
we're here to help
yeah,
people coming after
exactly.
you to know better. Yeah. Yeah. Yeah.
Exactly,
Yeah.
exactly. Um, are there like pieces of advice you have for folks who feel overwhelmed by fertility treatment? It's interesting, and I've seen this across the country where, people are nervous. First of all, they may not know that there's someone called a fertility specialist, a reproductive endocrinologist,
Hmm.
right?
Yeah.
Obviously, if you're joining in here, you do know that, but like, and then they're scared to see them. They're like, oh my
Yeah.
goodness, like I don't want to do IVF. That seems invasive.
Yeah.
Like, yeah, any tips or tricks?
Yes, absolutely. So it's very common that patients will feel overwhelmed by the whole process of, oh, I can't get pregnant to begin with, that, and typically that's when you see everyone around you getting pregnant. It looks like
Literally
so
my
it
experience.
can be really stressful. And then you hear about fertility testing and treatment, and oh my God, maybe it's painful. And then probably before I talk about this here, just talking about some of the misconceptions real quick, because there are some patients that think that infertility is only for those that have significant medical problems or
Right.
have poor lifestyle choices. So it's usually very difficult for patients that are women or men that think they are, doing the right things, exercising, eating healthy, taking supplements. The fact that they cannot get pregnant sometimes can just break them down, be so
That
stressful. Oh
was
my
me.
God, I'm doing
Mhm.
everything perfect in this world. How
Yeah.
come, and then you may know someone who smokes, who drinks alcohol, and then they
Oh
get
yeah.
pregnant, right?
Like
And,
that.
and like that. So it's very important for people to know that everyone is different and the genetics are
Mhm.
different, and doing the right things will improve your chances of being able to have a successful pregnancy, but it's not a sure, a guaranteed thing that is going to happen. And sometimes you may just need a little bit of help, or maybe 2 or 3 or 4 cycles, and then you may get pregnant. But it does not in any way mean that you should stop doing the right things, keep on exercising, keep on doing those things. You
Yes.
reap the benefits down the line for sure. Yeah. So for those that are feeling overwhelmed by all of this and not knowing what to do, I think we talked a bit about some of the things already. You want to have a strong support squad. And
Oh,
this can
yes.
be, yeah, this can be your partner, your friends, family,
Mhm.
or join a support group. And again, here, do your research and make sure that it's not a toxic group. And if you get in any group, you find out that they are toxic, just get away from them. You need one that you are there to know people who have experienced what you have experienced and who you can relate with, and to help you manage the
Yes.
challenges you're going through. So having a strong support group is very important. And then if the stress is too much, we talked about stress management, but you want to invest in stress relief strategies. So that this might be the time. And I have philosophies about the universe. I think sometimes some challenges come for you to just go to the next level in your development, to
Mhm.
learn to
It's true.
meditate, to learn to do yoga, to learn to
Yeah.
smile more, to do some hobbies that bring joy. So don't let the
Mhm.
challenge beat you down. Rather look to see what are some of the things I need to be doing to help me manage this better. So practice self-care essentially, and then if you need professional guidance, counseling or therapy, that might help. And then you want to stay informed but not overwhelmed. So there's so much information out there these days, TikTok and
Mhm.
everything. So make sure you are using the right sources of information. And that's why I
Mhm.
gave reproductivefacts.org, or come to CRM website, or use Conceive, information from Conceive, but use credible sources, because
Yeah.
the information sometimes can paralyze you. Um, and then keep your perspective. And I think this comes from talking with people who have been through what you're going through, that sometimes they can tell you, oh, it took me some years to get to, the point where we could have the child. And so when you hear those stories, it shouldn't don't get scared. Just know that there's hope for you. It may take a bit longer, but every step of the journey may help make you a better person in the process. Yeah.
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 Yeah. I love it. I love
Yeah.
it. It is clear you have such a like sort of magic touch. And if I were in Orlando and I was still doing this, I would come to you, Dr. Sante.
Thank you.
Um, you talked a little bit about support groups. I will do a quick plug because I have to. I think this, as I mentioned, this was one of the first insights I had when going through infertility, was that I felt really alone. And I realized people around me were going through it, but it took some time to get there where I felt comfortable being open about it. And sometimes that gets tricky, right? I
Yeah.
think, as you mentioned, everyone around me seemed like they were blinking and getting pregnant. And there's sometimes boundaries issues with like nosy in-laws or nosy
Mm,
friends, or,
mm.
who may be in it with you, but like it's too much.
Yeah.
And the jealousy seeps in. And so one of
Yeah.
the things we also do at Conceive is we curate these support groups based on where you're at in the journey, so that not only are they removed from your personal orbit, but they are, if you're going through IVF, if you're just getting started, if you're pursuing a gestational carrier, donor egg, donor sperm, doing this on your own. And so you have this virtual room now that feels like your people. And we've cultivated some best friendships. And there's a lot of magic that happens there when you can find the right support. And then in addition to that, of course, we've got the coaches who've all been in the shoes of the patient. So they also have that deep empathy and compassion for, okay, I see you, I feel you, I've been there. And let's talk about some tactics, because I think what you hit on was some of those frameworks for finding things and finding joy.
Yeah.
Because a lot of what, and I'll speak just for myself, like I let this take over my life for far too many years. And this
Yeah.
was all I was looking at, because I was one of those people where I felt like I was doing everything right. And so I was searching for the problem, because I was like, what is it? Like I'm doing all the things, like help me. And so, there is this balance you need to strike of like not overdoing it, not losing life, right? Because the reality is, before you have a child, you still have the ability to do things like travel and enjoy things, right? And not losing out on that. One of our head coaches, who has been through, I don't know, 13 rounds of IVF and had many, many miscarriages and losses, but has three beautiful children. She talks a lot about, one of the aha moments she had was like, after going through the grinder for a long time, not acting like she was pregnant before she was, and making sure they were still enjoying the things that they
Yeah.
could do while they were just a couple.
Yeah.
Um, so
Yeah.
it really is a balance. And this is a lot of what we do with our coaching. But with that, I'd love to take some of the audience questions, because I feel like we
We've
really
been
dug
at it
in
for a
here.
while. Yeah.
We've been at it, and we've got some good ones in here. So let's start with the first one. What are the treatment options for male factor infertility? And
Thank you.
they specifically said low count and volume. So that might be like this particular person's issue.
Yes, absolutely. So yes, when we see after the testing, if we have the semen analysis coming back showing that there's a low sperm count, there is ranges for the sperm count. So depending on how
Yeah.
low it is, almost always we are going to repeat the semen analysis just to make sure. So we don't always go by just one abnormal sample. So if anything is abnormal, we like to repeat it. If the repeat is still
Yeah.
coming back and it's low count, there are a number of factors that are known to cause low sperm count. Again, it will depend on what ranges we are looking at, but it can be hormonal, it can be genetic, it
Mhm.
can be anatomic, um, sometimes infections. We these days we have reproductive urologists. These are fellowship trained male
Hmm.
fertility doctors. We work very closely with them. We refer you to see them so that they will do the testing, they will do examination, scrotal examination, they will do ultrasound, and at the end of everything, they will be able to give you an idea about what the cost of the low sperm count is for you
Yes.
in your specific case. And then by way of treatment, usually if they're able to find a cause, in about 40-50% of cases, they usually will not be able to find any cause. But if they're able to find a cause, then they will treat it. And then once the samples improve, we can start treatment for you. And again, that would depend on what we found with your female partner.
Yeah.
If they are not able to help improve the sperm count for you, the options that we have for you as a couple will be IUI. Again, if there's just a
Yes.
slight decrease in in the count, especially if you have more than 10 million total mortal sperm, then we can do IUI. If the count is less than 10 million total mortal sperm, usually IVF with what we call ICSI or intracytoplasmic sperm
Yes.
injection is the best option. So IUI, IVF, or treatment from the reproductive urologist to help improve the sperm count for you. Those are the main options.
That's so helpful. And I think one of the cool things about sperm is we do know a bit about the quality because you can ejaculate sperm, whereas I wish we could ejaculate eggs because then we would know a lot more about the quality, but they also regenerate, right? Is it every 72 days? So there is possibility to improve certain factors. And a reproductive urologist is definitely the expert there. We have another one on semen analysis.
Now,
Someone had a, oh yeah,
real quick, just
please.
about so the quality of the sperm cells. So when we talk about quality here, we are actually talking about the DNA content. And sperm
Mm,
cells are just like egg cells in that sense, that they are just one cell. So you cannot really tell the quality of the individual cell. So the testing we do usually gives us an idea about the quantities, just like the testing we do for the
quantity.
females, the quantity.
Yeah.
Now, if we find things like increase in white blood cells in the sperm, in the semen, then it tells us that you may have a lot of oxidative factors that will
Yes.
predispose to the sperm cells being damaged. So then we think that you have a high likelihood of a lot of abnormal or damaged sperm cells. Um,
Like
so
DNA
like DNA
fragmentation, is that?
fragmentation
Yeah,
index is
I
something that we
gotcha.
can do to give us that information. Yeah. So, but
Yeah.
in general, sperm cells, just like egg cells, we cannot tell. So it's one of the things we like to tell couples that having a normal semen analysis is just like having a normal AMH. It doesn't tell us that the quality is good, unfortunately. Yeah. The only way we
Oh,
can
I
tell
see
the
what you're
quality,
saying.
yeah, the only
I
way we
got,
can tell
yeah,
quality is when we put the eggs and sperm together and then test the embryo. Yeah.
I gotcha.
Yeah.
So,
Mhm.
right. So there's some, yeah. So it is
Yeah.
more about kind of quantity and then like
Quantity.
the
Yeah.
factors of motility and morphology.
Yeah.
Yeah, I got
Yeah.
you. There,
Yeah. Yeah.
that's a good
Yeah.
distinction.
Yeah. Yeah.
Okay. And then we have one more on semen analysis. Someone had a semen analysis in December. The motility is a lot less, and some immature germ cells were found
Mm,
and bacteria observed. What can I
mm.
do now?
Yeah. 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 So you will definitely have to see a reproductive urologist. So the having excuse me. So the germ cells that we're talking about, we usually refer to them as round cells. So when we do the
Mm,
semen analysis, we look for the proportion of the number of round cells. You need to have less than 1 million round cells. If it's more than 1 million round cells, that's a red flag. And then they will go on to check to see if those round cells are immature sperm cells or white blood cells. So
mm,
so if they are white blood cells, then they will screen for bacteria. And so if the bacteria is positive, then it means that it's and these days, most of the time, if we find that they are white blood cells, you don't necessarily need to look for the bacteria. You know that there's some infection. And so
I see.
you will refer to the reproductive urologist. They will treat with antibiotics and then also give you
Yeah.
some NSAIDs or anti-inflammatory drugs
Mm,
for usually anywhere from about 2 to 4 weeks. And then they will repeat the sample sample about 3 months later to see. Yeah.
Got it. Got
Yeah.
it. Is
So
that this semen analysis, is this what's observed in a normal semen analysis? Would bacteria always be picked up, or was this
no,
something special?
that's like, yeah, that's special. We don't
Yeah.
always look for bacteria.
Yeah.
Yeah.
That's so
Yeah.
interesting.
Yeah.
Okay. And then someone wanted to clarify that they should avoid high glycemic foods. So just wanted
Yes.
to mention that. Yes.
Yeah.
And
Yes.
then the last question here, do you think egg quality can be improved? I have a perspective. I'm not the doctor. So Dr. Asante, this is for you.
Yeah, so that's the $1 million question. Okay, so
Yeah,
the American Society for Reproductive Medicine has a statement on that as of now we don't have any medications that have been shown to improve air
correct.
quality. Now,
Yeah.
having said that, there have been studies that have looked at things like CoQ10, DHEA,
Yes.
even melatonin,
Hmm.
Ovasitol, and some studies have shown that a patient that had either low egg count and abnormal embryos when they put them on it for 8 weeks and then did the IVF stimulation again, they got good
Better
numbers of
outcomes.
better
Yeah.
outcomes. But then other studies, placebo, have shown that it can happen with even with those without
Right.
those supplements, right? So,
Hmm.
and that's why we are saying that there's no bullets, silver
Can't
bullet
measure
out
it.
there
Yeah.
that can we can say take this and your air quality is going to improve. But
Hmm.
we know that several factors that we've talked about, lifestyle, anything that can potentially improve the chances, you want to make use of them. So exercise, eat healthy, stress management, adequate sleep, take those supplements. They are not harmful. They may help, but they don't guarantee that they're going to work.
Yeah,
Yeah.
yeah. And the reality is it's like not measurable, right? Because it's
Yeah.
like you have to, and the
Yeah.
eggs only last so long in the lab. So it's hard for us to really see that stuff. So it's unfortunate that there's no definitive evidence that it can be improved. It's not to
Yeah.
say that it can, but we just don't really know.
Yeah.
And we had another question like this, can I improve egg quality between IVF cycles? So
Yeah.
we already
Yeah,
answered that.
yeah. But yeah, so just to again elaborate on it some more, if we have a patient that we do IVF for, they get maybe one or two embryos, we test them and they come back abnormal, usually we can put them on all these supplements if they are not taking them already, and then
Sure.
there are medications like human growth hormone that we sometimes use too, because some
Yeah,
studies have shown that they may improve, but again, nothing out there is 100%. So
correct.
patients that may not do any of those, we try again, and the next time they get good embryos. Some patients
Yes.
will do it, they may not get good embryos, but some may do it and may get good embryos. So yeah,
Yeah.
that's where we are now. There's no definitive
It's so
medications.
interesting because
Yeah.
there's so much we know and we've come
Hmm.
so long, so
Yeah.
far since IVF,
Yeah.
was created over 40 years ago, but we still have a long ways to go,
We
which is why
do.
I'm excited about a lot of the innovation,
Yeah. Yeah.
both on the
Yeah.
science side, on the operational side.
Yeah, me too. Yeah, I
Yeah.
think we'll get there.
Yeah.
We will get to the point where patients with the diminished ovarian reserve may be able to either use stem cells to get good eggs, but we are not there
It's
right this
exciting.
moment.
I
Yeah,
know. And
we may
even
get
things
there
like
someday.
IVM,
Mm.
where you
Yeah.
can,
Yeah.
avoid the 2 weeks of pain from
Yeah.
stimulation and just
Yeah.
extract the eggs and have them grow in the lab. There's a lot of exciting things coming up, but
Yeah.
there's still some unknowns. But I,
Mm.
I wanted to thank you so much, Dr. Asante, for this. This was so fun for me. I learned a lot. I took notes. I feel like I'm an expert already, but I'm apparently not. We talked about all of the kind of basics you need to do for a workup before you can kind of pursue treatment. We talked a lot about lifestyle factors and how
Yeah.
critical just sort of being healthy and taking care of yourself is,
Yeah.
and how to set also boundaries with friends and family and take care of yourself. Take care of
Yeah.
yourself while you're going through something that is equally emotional as it is sort of a medical journey.
Yeah.
Um,
Yeah.
so if
Yeah.
you're considering getting a consult with CRM, I couldn't recommend them more. Dr. Asante, you are incredible. Again,
Thank you.
would come to you if I lived down in Florida. And we are excited that Conceive is available to you as a
Yeah.
CRM patient.
Yeah.
We offer 24/7 texting, curated community groups, and really just around the clock support to reinforce Dr. Asante and the incredible team's approaches to the medical journey. So thank you, Dr. Asante. Is there anything I didn't ask that you wanted to mention before we wrap up?
I think you asked all the very, very important questions, and probably the one thing is we didn't touch on. We probably did is the fact that patients may sometimes have doubts about starting treatment. They come in, get the
Yeah,
information, and should I do this? Should I do that? And
yeah,
for those patients, what I usually tell them is my favorite quote, all time favorite quote, which is from Albert Einstein, that life is like riding a bicycle. The only way you can maintain your balance is by moving forward. So
so
you may
true.
have the doubts, but you need to make a decision, move forward. It's
Move
not
forward.
possible to get all the information you need and know for sure that you're going to be able to get pregnant before you start. It just doesn't happen. You have to take the first step, and then
Yeah.
you gain clarity as you move forward. Yeah.
Yeah. Well, with doctors like you on your team, it's a real pleasure. So thanks everyone for
Thank you.
joining us. Huge thank you to you, Dr. Asante, for sharing your expertise. We hope you all feel more prepared, more supported as you move forward in your fertility journey.
Thank you. Thank you, Lauren. You have a great one.
Okay, awesome. Take care, everyone.
All
Bye.
right. Bye.